Dr. Jessica Dupont. Welcome to the Urban Pharmacy, my friend. I'm so excited to have you here.
I'm excited to be here. Thanks so much for having me.
Yes. Okay. So let's dive right in. I have got a whole little grab bag of questions that I fielded from friends and
Okay.
clients. But before we even get into those, I want to know, where did your health journey start?
My health journey started when I was in university and I was given lots of antibiotics for frequent UTIs. So I was getting lots and lots of UTIs I think I was on 30 rounds of antibiotics in a matter of 2 years because and it still happens today. We go into the clinic or walk-in clinics and we say, well, I think I have a UTI. They do a urine sample, right? They kind of do like a dipstick and it shows, oh, you have inflammation. So yes, it's a UTI and they give you antibiotics, but they're supposed to send it away for actual analysis to see if there's actual bacteria there. And what I found out is that after 2 years of doing this, that I only think I had an actual infection 2 out of those 30 times. And the other times it was just inflammation. So I was in and out of hospitals with back pain. And somebody finally said to me, you should see a naturopath. And I was like, what is that? Like, I don't even know what a naturopath is. But I did, I trusted that information and I went to see her. She was amazing. She sat with me for a good hour and a half the first time I met with her. And what we discovered was that I had something called interstitial cystitis, which is just basically an inflammatory bladder syndrome. And so we changed my diet, we did acupuncture, she cleansed my kidneys. So it was amazing. And ever since then, I haven't had any UTIs. I definitely saw the association between stress and my symptoms too, which, I mean, nothing like that was ever taught with medical doctors or anything like that. And I was just kind of pushed through the medical system, which a lot of women are, a lot of people in general are. So that's kind of where my journey with health all started. And before that, I had wanted to go to medical school. But when I saw her, I was like, no, this is the route I'm going with naturopathic medicine.
Love it. I love it.
Yeah.
Okay. So going back to that, Jess, can you explain to us, how does one cleanse their kidneys?
So when it comes to, so kidneys are part of the emunctories, right? So when we think of detoxification and those organs, the liver is kind of the primary one, but the kidney is part of the emunctory. So it's part of the detoxification system, but it's one of the elimination pathways. So similar to the bowels. The kidneys can be cleansed in various ways. Obviously, drinking a lot of water is one of those ways. We tend to just dehydrate ourselves like crazy, especially having a lot of caffeine. So one of the things that the kidneys do not like is caffeine. They don't like chocolate. It doesn't like anything acidic, and stress. So all of these things can really impact the kidneys, dairy being one of them as well.
Okay, hold on. Before you go on, I have a question.
Yeah.
When you speak about acidity, what are your thoughts on tomatoes? I know that that's like such a really random question, but like I've just seen some weird, like conflicting stuff about how tomatoes might go into the body acidically, but then they turn alkaline, like once they hit your gut. I don't know if you know anything about that.
Tomatoes will stay acidic.
Okay.
The one thing that does turn alkaline though is lemons.
Yep. Okay.
Yeah,
I've heard that
but
too.
I know tomatoes will still be acidic. You see it a lot with heartburn patients, or
Yes.
like me with my kidney stuff, I couldn't have any tomatoes. I'm okay now.
Okay.
But it will stay acidic.
Okay.
As far as I know. I mean,
Yeah. No, I mean, I knew about the lemons, but it's been a little bit iffy on the tomatoes. So I wanted to see what you thought on that. Okay.
Yeah.
Cool. All right. So
There's some,
moving on.
there's some
with
really
that.
nice herbs that are really good for the liver. Dandelion root is one of them. So dandelion root is fantastic at cleansing out the kidneys, but also the liver. Of course, you have to be cautious with people who have high blood pressure or on blood pressure medications, but I love nettle root, right? Nettle root is awesome. It's a super nutritive herb, but fantastic for the kidneys. There's also like there's so many different ones. Oh gosh, I could go on, but there's a lot of herbs you can try. There's even cleansing powders that you can use for the kidneys, but you have to obviously do what's right for you and your body. Lots of foods that can help. I love even dandelion greens and those bitter herbs. So they're all really good.
So we can start with water if we want to just kind of cleanse our kidneys. And then seek a naturopath to have a little bit more guidance with it. Okay, cool. Okay, so you started there, and then when did you start practicing naturopathy? Where are you in Canada again?
I'm in the GTA. So I'm in Ontario,
Mhm.
in the Greater Toronto area. So I started practicing in 2013. So basically, after I got sick and I graduated from university, I applied right away into naturopathic medicine. It was a 4-year program. And this was after doing your 4-year of undergrad. So it was 8 years overall. And yeah, my journey kind of started off, I always wanted to be an OBGYN. So I kind of naturally gravitated towards seeing kids in my practice and seeing women. And I'm a doula as well. So I help with childbirth and I attend births with women and help kind of guide them through labor. So my whole practice then kind of shifted more towards the fertility because it just sort of came hand in hand, right? Like you see a lot of women, you see families, and the prevalence of fertility is just on the rise. Like it's everywhere, fertility issues. And so my practice had kind of gravitated towards that.
Yeah.
Mhm.
I went through IVF.
Did you?
I did. I felt as though I'd exhausted all things. And it's just,
Mm.
it of course was linked with thyroid hypothyroidism.
Right.
Um, and hormones are just like so hard, Jess. I mean, I am in no way, shape, or form an expert, nor even like I don't even want to say I'm like a beginner level at understanding hormones. And I feel like there's so many women there. I mean, hormones are so loaded and individualized. Like everybody just, it's like, it's
It's
kind
so
of hard to give.
intricate.
Yeah,
Yeah.
it's hard to
It's
give like one recommendation, I'm sure, for you. Like, okay, well, this is
exactly.
how we're going to tackle this. Because there's just so many, I don't know. It's like, well, this might shift this hormone and that's going to shift that. And like, it's a whole system and it all works together. And what do we need to tackle first? So,
Exactly.
um, let's talk a little bit about adrenal fatigue. Like, what are your thoughts on this? I know that this term has been thrown out for so long. A few years ago would throw it out and I'm like, I know I have adrenal fatigue. I know my adrenals are burnout. Like, but then I read from some other doctors and they're like, adrenal burnout isn't real. Like, that's not a technical thing. So, like, what's going on with everybody feeling like their adrenal glands are burnt out? And like,
Yeah.
what are the things that, I mean, I guess my question is it real? Is
Mhm.
adrenal fatigue or adrenal burnout real, or is there difference? And then, what's going on? Like, why are we all feeling so burnt out?
Yes. So it is a real thing, whether you call it adrenal fatigue or adrenal exhaustion or burnout. The thing is, it's not a medical term. It's not a medical diagnosis, which is why in the medical community they go, this is not a real thing.
Yes.
But you could say the same thing about IBS and fibromyalgia and chronic fatigue syndrome,
Right.
right?
Right.
So
Yes.
when it comes to cortisol and adrenal health, there's 3 sort of phases that your adrenals go through. We have this kind of acute alarm phase, which naturally our adrenal glands should be able to handle, right? So our adrenal glands will pump out adrenaline and cortisol under times of stress. So when maybe we get stuck in traffic, our adrenal glands will go whoosh and kind of secrete all this cortisol. So our cortisol goes up and helps us kind of cope with that stress. And then as the traffic starts to clear, our stress comes down. So our cortisol comes down. So our cortisol will naturally fluctuate up and down throughout the day very naturally. And your adrenal glands should be able to handle that. But over time, this becomes harder to do. So then we hit like a different phase of issues when it becomes more chronic. This is kind of that CEO type person who's like, go, go, go all day, pushing their adrenal glands like crazy because maybe they're under stress all day. They're drinking coffee, which is further depleting their adrenal glands. Their blood sugar is dropping because they're not eating well. And they feel like they're thriving on stress because their body's pumping out all this cortisol. But then they get home at night and they just absolutely crash. So
Mhm.
that's kind of that phase 2. Then you have phase 3, which is what you're talking about, which is more of that burnout. So over time, and this could even just be a couple of months for some people of chronic stress. This could be a few years before this happens. I see it a lot in postpartum women because what's happening now is your adrenal glands are tired. They're like, I can't even pump out enough cortisol to keep you functioning here, right? It's trying. So then what happens is your adrenal glands go looking for ways to make more cortisol because there's not enough cortisol to keep you going. So the way that it does that is it picks up your hormones. So it takes progesterone and it takes testosterone to make more cortisol. And so that's where we start seeing all of those hormonal fluctuations. Now we're seeing big issues with our sleep. We have brain fog, lack of focus and concentration. We're waking feeling tired. We are reaching for that afternoon cup of coffee in the afternoon. So at this point, a lot of women even experience, or even men experience bowel issues, joint pain, neurological issues. It can get to the point of being very, very severe. It can mimic depression. So a lot of people are misdiagnosed with depression when it's really the adrenal glands that you need to work on. So I know this exists. It's 95% of my patients.
Yeah. Yeah.
You know, and it's me, like I'm a postpartum mom too. I'm not sleeping well. I know my adrenal glands need support right now.
So, yeah. So when we hear like the medical doctors saying, or like the doctors that are practicing allopathy, you know, they're saying, adrenal fatigue like doesn't exist, or adrenal burnout doesn't exist. Well, that's because there's probably some other medical term that is, you know, part of the puzzle. That's part of this bigger picture of adrenal fatigue overall. And it's like, you know, then which ones do we need to pinpoint to then, you know, support the adrenal system? So I think that that can be confusing for people, but I agree. I mean, I definitely think that I've been through all three of those phases. When I went off of birth control after being on it for 15 years, that's when my thyroid crashed, and that's when my body like just like crashed. I was in the stage 3.
That makes sense.
I could tell when I was in the stage 2, I was like, oh, I'm all right. But then literally like a month after, and I probably 20 pounds later, like it was like rapid weight gain.
Yeah.
I was literally like, oh my God, I'm going to get in my car. I'm going to go to my Pilates studio. I'm going to teach 1 hour, and I'm going to come home, and it's going to be amazing if I don't fall asleep on the way home. Like I was that tired. I was asleep in my driveway when I got home, or I would get myself into the house and I would lay down on the couch and just like sleep. And that is like crazy. I was like, what is happening to my life? Like I was so, I could not do anything. I went like raw vegan. Like I was just trying to do everything that I could to like not stress the body, like to, you know, take the lemon balm, like to take all the tinctures. Like I just did not know what to do. So when you see women, let's talk about food. Like when you see women that are experiencing adrenal fatigue on some level, whether it's stage 1, 2, 3, are there specific foods that you're recommending to people? Are you saying maybe cooked foods versus raw foods? Or are you saying like, let's lean a little bit more on these adaptogens, or like, you know, let's look at, I don't know, those bitter greens. Like what are your beginning recommendations there?
So there's a couple of things I normally suggest. I usually combine herbs with differences in diet and dietary changes and lifestyle changes, of course. So when it comes to diet specifically, we talk about making sure that you have that balanced diet of healthy fats, healthy proteins, primarily plant-based proteins, because you want to make sure your liver is functioning well. And those animal-based proteins are going to add more fat around the liver, making it more difficult to shuttle the glucose out of your blood. And with adrenal fatigue or any adrenal issues, our blood sugar is crashing constantly, and those blood sugar crashes are going to further our blood sugar issues. So I always say that we need to protect the liver. That's one of the biggest things when it comes to kind of fats in your diet and sticking to plant-based protein. Lots of fruits and veggies with your antioxidants and your B vitamins to help, because B vitamins are fantastic in those pathways to support stress. When it comes to avoiding things, I absolutely say to take out sugar, because your white foods, your refined grains, all of those things are going to bump your blood sugar, and then you're going to crash. And that crash is going to further deplete your adrenals. So taking out all the whites, I usually say take out the gluten, really just kind of support your body with things like whole foods, nutrient dense, lots of veggies and fruit. And I don't necessarily say to go raw or or cooked. I kind of tell women to feel it out. If they find they're having a harder time digesting the raw, then I will usually lean towards, steaming your veggies a little bit or something like that. But usually they tend to be okay. The other things I usually suggest are what else was it? The herbs, ashwagandha, rhodiola, those are beautiful herbs, licorice root. All of these are really fantastic herbs and kind of lifting the adrenal glands and supporting that. Of course, with any herbs, you kind of need to look at where women are in terms of their adrenal fatigue and what herbs might be more beneficial. But I do love those. They're very safe in general, and they do tend to kind of help lift the adrenal glands just to give the extra support that it needs.
Right. Okay,
Yeah.
good. Okay, so, Jess, what are the main hormones that we need to be in tune with? I mean, could we just have a whole episode on that, or like what? Like what?
The most important ones?
Yeah, what are the most important ones? I mean, maybe the top 3 or 5?
Yeah. So we could definitely go into that. Back to your last thing too about adrenal glands really quickly. Hands down, if you have adrenal fatigue.
Oh, wait, hold on. You cut out for a second. You said something
sorry.
and then
can you hear me now?
Yes.
I was just going back quickly to our previous conversation about adrenals, is cut the coffee.
Yeah. Oh yeah.
Because coffee will plummet the adrenals.
Yes,
okay.
yes,
So when it comes to our hormones, the ones that I look at in particular are your estrogen, your progesterone, testosterone, cortisol, and your thyroid. Those are kind of the ones that I look at first and foremost. Obviously, if you're dealing with fertility issues or you're dealing with cycle issues, we do lots of blood work with many, many other hormones, but these are the ones that if you're an individual on the outside kind of thinking, what are my hormones doing? You want to know what those ones are doing, because those are the ones that are going to regulate your cycle. They're the ones that are going to affect your libido, affect your sleep. And so we can't just look at our sex hormones like our estrogen and our testosterone without looking at the adrenals and the cortisol and without looking at the thyroid, because it is all related. So what I usually tell people to do is look at their menstrual cycle as a guide, right? So your menstrual cycle has an innate wisdom in itself to tell you what's going on in your body. If it's irregular, if you have heavy periods, if you have a lot of cramping, if it's lasting a really long time, if you have tons of clots, those are all signs that there's an imbalance going on. And so something is going on with the hormones. But if everything is going really well, even, no PMS, you're feeling very vital during your whole cycle, that could be a good indication that your hormones are doing really well. And I feel like we do tend to blame our hormones a lot, right? We tend to say, well, like I get patients in my chair they come in and they say, my hormones are out of whack, we got to fix this. And I go, okay, but you know that the hormones are not the cause, right? So the symptom is the hormonal issue, right? The hormones going out of whack are basically a symptom of an underlying cause. So even though the estrogen might be low or the progesterone might be low, you need to look at the liver. Is the liver metabolizing your hormones properly? Toxins and heavy metals coming in, looking at stress, and sleep and all of those things, which will obviously make your hormones go out of whack.
Yeah. So is it that people can't sleep because their hormones, or is it because their hormones are out of whack because they're not sleeping right? Like which one?
Vicious cycle.
Which one?
And that's the hard part. That's the thing we try to do as naturopaths is be like, okay, where did this all begin? And let's see what started, like what happened first.
Yeah. So, okay. Cortisol. What is it? Why do some people want to raise it? Why do some people want to lower it? How do we balance it?
Okay. So that kind of brings us back to the adrenals. So when you are in that fatigued state, so if you're looking at the different the phases of adrenals, so remember that CEO type person who's like pumping out tons of cortisol, they're going to have high morning cortisol. Women with PCOS usually have high cortisol as well. So in those cases, you want to calm the cortisol. You want to actually bring it down and regulate it. Now, if you're in that exhaustion phase and you're literally falling asleep on the way to work or on your way home, that's where you need to bump up the cortisol, right? So you definitely have to see what phase you're in. Like if you're feeling exhausted, really depleted, likely you need to lift the adrenals. If you're feeling like you're anxious, tons of anxiety and go, go, go and thriving, and you're like shaking all day, drinking coffee to keep yourself going, that's where you're going to need to kind of depress that cortisol and try to bring it down.
Okay.
Yeah. And honestly, that's going to be, again, just making sure you're getting good sleep, changing your lifestyle to, do some meditation, do some yoga, get out in nature. I really am a true believer of getting negative people and stimuli out of your life, just things that don't serve you. If you're in a job that you hate, I realize that you may not be able to quit your job, but maybe you can start to look at other avenues that bring you joy, delegate tasks. That's sort of on the lifestyle side of things. But then there's herbs you can do, nutrition and all those things. You just really need to do that self-care, which is so important. Mm-hmm.
And I just caught you doing something that I do too, Jess, like literally right after you said, get the negative people or quit that job, quit that toxic job, you automatically said, I realize you might not be able to do that. And I do the same thing. I mean, but I know the power because I was in that situation. And not to say that like the people that I was working with and like my clients, like those were all lovely, but the actual like ownership of a brick and mortar was toxic to my body.
It is.
And like, I had to quit. I had to. And it's like, I think that I'm going to be that type of person. I've just decided recently that I am going to be that type of person that's like, this is what you need to do if you want to change your life. Like, and I realize that it might not seem possible, but you're going to have to make it work. Like
Exactly.
you got to do that tough love because guys, like it's putting a tremendous amount of stress on our body if we're surrounding ourselves with the wrong people. And if we're waking up and doing something every single day that we just don't love, like that is
I always tell my patients, I said, you don't want to be at the end of your life on your deathbed and thinking like, oh my God, I spent literally like 50% or more of my life onto something I hated and didn't enjoy.
100%. Yeah.
There's so much fear in, leaving that 9 to 5 to do something you love or start your own business. There's so much fear around that, especially if you have like a regular income and you have benefits. And so my husband is a prime example. He was, he did like enjoy his job. Like his boss was great, but he had that 9 to 5 and he's like, you know what? I want to be a photographer. Like he just decided this one day. And I was like, okay. And he just quit his job and he went for a few weeks out east and took some pictures and he came back and he's like, yep, this is what I'm going to do. And he is now a really successful wedding photographer. He does a lot of photography for even like hockey players and some of those influencers downtown. So he's a prime example of somebody who just went for it. And he was just like, you know what? The universe is going to give me what I want. And it did.
Yes.
Where I was the hesitant one. And I was like, are you sure you want to do this?
Okay.
But I was very supportive.
Kyle Heine, if you're listening to this episode, which I know you aren't, honey, you need to listen to this because you can farm and you can make money and we can make money with elderberry syrup and the universe will provide.
Absolutely.
I promise.
I'll buy your elderberry syrup.
Yeah. Oh, yay. So yes, I mean, it can happen. And especially once I get my family medicine or family herbalism certification, which I'm working on. I'm super excited about that. But, and yes, just back to, like that vision casting. I was actually teaching my team last night about vision casting. And I love how you were saying, like, you tell patients, like, you don't want to be on your deathbed thinking like, God, what I do for the last 50 years. Like, think about what you want your legacy to be like, guys, like listeners, like think about what you really want your purpose in life to be and go for it because we only have one. So we might as well just step into it and start walking toward it.
Exactly.
Without that
especially if you even realize that you're getting home at the end of the day and you're so irritable because you've like hated your job that you're just not enjoying time with your family. Maybe you're snapping at your family, your relationship is starting to suffer. Like all those, it's not worth it.
Yes.
Or you're drinking alcohol or things to kind of just like damper or, smoking marijuana and all these things to just kind of keep yourself calm and help yourself move through the day. Like it's not worth it. Right.
Right.
Yeah.
Totally. Totally. Okay. So let's go back to hormones. I mean, somebody wanted to know how to regulate. This is so like overarching, like
Yeah.
how do we regulate hormones naturally and how to tell if they are off in the first place? And you've kind of gone
Okay.
through this, but what are some
Yeah.
common symptoms?
So the big one, oh gosh, the symptoms are many. Likely the hormones are off,
Right,
especially if you think they're off, they're probably off. The menstrual cycle is where you need to start first. Look at your menses. Is it regular? Or are you
that
skipping?
actually just folds in with another question that somebody has.
Yeah.
So I'm going to ask it at the same time. What is the most common cause of irregular or non-existent periods?
Yeah. Okay. So, and we'll get into that too. So our menstrual cycles should be about anywhere from 26 to 32 days in terms of their length. Any shorter than that is telling me there's something going on here. It should be regular, coming every month. Okay. You shouldn't skip a month here and there. The first 2 weeks of your menstrual cycle is where your estrogen and your FSH, or your follicle stimulating hormone, is raising. Your testosterone is also raising as well. So during when you're actually on your menses and you're bleeding, during this phase, it's actually very normal to feel fatigued. This is the time when we need to start listening to our cycle, because different phases of our cycle tell us if what is going on is normal, and if like how we can kind of harness those times. So this is the time where you're going to feel like you want to just step away from things with friends. You're going to want to kind of be a recluse, sitting on your couch watching TV. Totally normal. All your hormones are at an all-time low at this point. Estrogen is low, progesterone is low. You're going to feel tired. As maybe you move through day 5, so your cycle should last anywhere from 3 to 5 days. Any shorter or longer, again, I start to think, there's probably an irregularity. Should not be painful. We should not normalize cramps. We should not have tons of huge clots. Mild clots are okay. But any other color of blood that is anything but bright red as well could be a sign of other things going on. It could be a sign of infection, or just old blood that's kind of stagnant in the uterus that hasn't been shed from the previous cycle. So, and there should also be no PMS, right? So as we approach ovulation, which happens about mid-cycle, our estrogen is on the rise and our testosterone is on the rise. So you start to feel more energetic. This is maybe the time where you want to exercise more, do more vigorous exercise. You can eat more. You still want to have a little bit more warming foods here, but you can introduce a little bit more raw, and your digestion can handle it. So your libido goes up. You start to feel more optimistic and that sort of stuff. So you could take on more work tasks. Ovulation is like the prime time to do that, because your testosterone and estrogen are at its highest. After ovulation, things start to come down. Your progesterone will actually rise. So progesterone starts to be the dominant hormone at this point. Progesterone is the relaxation hormone. So this is where you start to feel like, again, maybe you're like getting into that point of wanting to kind of settle in, get more quiet. So women will start to maybe back off on their exercise regimen, or you should introduce more of those warming foods again in preparation for your next menstrual cycle, where all the hormones are going to drop. So if there's any imbalances in estrogen and progesterone, because that should be kind of like a certain ratio, then you will see estrogen dominant like symptoms, usually where you have those heavier periods. Maybe you have endometriosis or fibroids, or really heavy periods, and PMS, right? So in the last half of the menstrual cycle, it is normal to feel fluctuations in mood, but it shouldn't be to of depression or anxiety, and you shouldn't be having insomnia and things like this. So always look at the menstrual cycle. That's the first thing you want to look at. Now, causes of an irregular cycle or a missing cycle altogether, there's a few. The most common thing I see is a progesterone deficiency. So not enough progesterone to help kind of encourage that last half of the menstrual cycle. So this I see a lot in PCOS women as well. So PCOS is the most common diagnosis I see for skipping cycles altogether. Or if you don't have a cycle for a couple of months, then it comes back, or you're having a 30-day cycle, but then a 44-day cycle, and then a 60-day cycle. Definitely look for PCOS. The other things are high prolactin. High prolactin will
How does
shut
somebody
down.
look for PCOS?
So first thing is, so the one thing about PCOS is you assume that you have to have polycystic ovaries, and that is not true. So you can have polycystic ovaries, but you also have to look at, do you have male hormone characteristics? Like, do you have a lot of acne along the jawline or your back? Do you have a facial hair growth that you're literally needing to like remove? It's that dark and thick. Or are you showing high male hormones on your blood work? So it does take a lot of blood work. So you want to test the majority of your hormones on day 3 of your menstrual cycle. And then you want to test progesterone 7 days after you ovulate. But a lot of women don't know when they're ovulating. But you might see imbalances in the hormones that are indicating that there is PCOS there. Blood sugar as well, testing blood sugar, because a lot of women will have blood sugar issues, and thyroid associated with PCOS too. So ultrasound and blood work is going to help you diagnose those things for sure.
Got it. Okay. And real quick, back to the fibroid.
Yeah.
That affects fertility, correct?
Yes. It depends on where the fibroid is located. So it can be like, and so what I mean by that is it could be inside the uterus. It can be in the uterine wall, and then it could be kind of outside the uterus. If it's within the uterine cavity, those are the ones that are going to affect the fertility the most, and the size matters too.
Got it. That was a question as well. So, okay, I'm going to try to gather all the rest because I know we're sort of wrapping up here. Let's see. How do we increase progesterone naturally?
Right. So one of my favorite, I love doing acupuncture. I think acupuncture is a fantastic way to encourage hormone regulation in general. And progesterone. So have you ever heard of seed cycling?
I have.
Yeah. So seed cycling is actually a great way to regulate hormones in general. So it just involves, at the first 2 weeks of your menstrual cycle, you're cycling with 2 different types of seeds. And then the last half of your menstrual cycle, you're cycling with different seeds. And the first 2 weeks, you're kind of it's focused on bumping up estrogen. And the last 2 weeks is focused on bumping up progesterone. So, with progesterone specifically, I love using an herb called chaste tree berry. That's probably one of the best ways of increasing it more quickly, like if you're not using food. So chaste tree is a relatively very safe herb to use. It helps balance that estrogen and progesterone. So I really do love that. If your progesterone is in the toilet, like if you've had it tested and it's like non-existent, that's where you may want to consider maybe bioidentical hormone therapy for progesterone.
That was another question. So we're kind of hitting all of them. This is really great. So what about hormone replacement during menopause? Are there pros and cons? I mean, are there places for hormone replacement when people are not going through menopause? Tell us all the things that you think about them.
For sure. So I really prefer the bioidentical hormone replacement route versus the synthetic hormone replacement route. So a lot of what you hear about today is more that synthetic hormone replacement, which comes with a lot of safety issues. There's safeties around estrogen dominant cancers and breast cancers, increasing heart disease and risk of stroke, where bioidentical hormones were kind of introduced to navigate those risks. So bioidentical hormones, although they're made in a lab, they are more chemically and molecularly identical to your own body's hormones. So your body actually can't really tell the difference between your own body's hormones and the bioidentical hormones. The synthetic hormones, though, actually bind to your estrogen receptors and activate them, which can be a little bit more dangerous, I guess, in a way. And it'll also have a lot more side effects to them, where the bioidenticals don't have many side effects. You always start with a low dose and work your way up. And it is a balancing act. Like you never want, so for menopausal women, for example, who have lower estrogen, you never want to just give estrogen. It has to be given with things like testosterone as well, or even progesterone as well, because you always need that balance of estrogen to progesterone and that estrogen to testosterone. So that's something to consider, is usually you're not kind of given one hormone, except progesterone. That's the one I see a lot given. That's the one I recommend a lot, especially even for my fertility patients, women with history of frequent miscarriage. You'll even notice people going through IVF are automatically given progesterone because it just helps solidify that pregnancy. And it's very safe to do throughout the first trimester. So there's definitely room in both realms. Here's the thing, I sort of treat with herbs first. So I always say the bioidentical hormones is kind of like last resort. And I usually with the herbs, we're able to bump up the estrogen and the progesterone and testosterone where we need them to be, even in postmenopausal women. Sometimes they'll know. Some people don't respond to the herbs, and that's okay. And then we kind of consider the bioidentical route. Menopausal women, you have to also consider. So I always look at symptoms. Some women are moving through menopause just fine, right? And they have no hot flashes, or they have one or two, and they're like, I'm okay with that. Some women have a really hard time, right? And this is where we're like, okay, like, because we don't want to stop menopause from happening. This is a natural process, but we can definitely make yourself feel a little bit better and navigate through menopause in a easier way, I guess. The one thing though that I do want to mention is that drop in estrogen after menopause also affects different things. So brain health, for example, bone health in women. So then we play with the idea of, should we be supporting estrogen in menopausal women, regardless of what their symptoms are, because it can help prevent things like dementia and cognitive, just memory issues and bone loss. So there's also that consideration as well. Many things to think about.
So many things. Yeah. So there was a lot of questions about hormone replacement, actually, now that I'm looking through all of them. Like, there was just a lot of them.
We need to do an episode just on that.
Yeah, we could. I mean, so, okay, Jess, last question before I ask the question that I ask all of my people, all of my lovely guests. What do you do when sex drive is a no-go? And yeah, we'll just leave it at that. That was it was a long question.
Sex drive is driven by 3 hormones: your estrogen, your progesterone, and your testosterone. And these hormones are not only made by our ovaries, but they're made by our adrenal glands as well. And so we have to look at, why is libido low? Okay, so which hormones are being affected? Is your testosterone low? Is your estrogen low? Or is your progesterone too high? Because it's the higher progesterone that's going to deplete your libido. The other thing is cortisol and stress playing a role. So we know that when we're under stress, that's going to shut down your testosterone. Your testosterone is going to drop. When you have a thyroid condition, your testosterone is going to drop. So it makes sense when the libido drops with these conditions. Is it mental and emotional, right? So is there a psychological barrier that's happening there? I see this a lot with my postpartum moms, right? Their bodies just went through a lot. They feel like their body has changed and they don't feel as sexy. You know, maybe they had a lot of trauma to their perineum. So they're afraid to have intercourse again. And then of course you just have like the postpartum hormones, which are just, you know, your estrogen is in the toilet. So it makes sense. You don't have the, and in menopause, you don't have the estrogen there to give you the vaginal lubrication and that sort of stuff. So you have to look for the root cause of why the libido's low.
Yeah.
And treat. There's not like one thing that's gonna be like, this is gonna bump your libido. Like there's fantastic herbs like maca and tribulus, which will naturally bump, you know, testosterone levels and support your adrenals. And ashwagandha is another one that both men and women could use. But you want to know what your testosterone is doing before maybe starting tribulus, because if your testosterone is too high, you don't want to do tribulus.
Got it.
So you got to be careful with that.
Got it. Okay. And all right, Jess, before we wrap up, I want to know, my friend, what does holistic living mean to you?
So it's many, many different things, but it's basically an all-encompassing nature of living in a community and creating an environment around you that is just supporting your body's innate wisdom to heal and thrive. So it's about the food you eat, right? And, you know, eating foods that actually nourish your body and support your body. It's about utilizing medicine that's given to us from nature. And, you know, we don't need to put these synthetic things in our bodies. Our universe and our nature has given us all the remedies that we need to heal and bring our bodies back into balance. But I also believe that it's not just about the physical, it's about the mental and emotional, and it's about the spiritual body as well. So really making sure that on all levels of health, that you're feeling balanced, because I find that a lot of people focus on the physical, but there's still so much going on up here that you need to balance out. And that spiritual piece is really the key. I've seen people heal their bodies with just meditation, right? And so I really do believe that we can connect to kind of those outside sources to really kind of thrive in our environment And again, surrounding yourself with those communities and gardens and things that support you as a person. So that to me is holistic. It's that all encompassing, it's food, it's spirituality, home, eco living, all of that is important.
For sure. It's all connected.
Yeah.
Oh my gosh, friend. Okay. Thank you so much for your time.
Thank you.
We will
for
have to have
having
you,
me.
we will have to have you back and talk more hormones, but
I'd love to do.
my friend, be well, and we will talk soon.
You too. Mwah. Bye.
Bye.